things every pregnant woman must include in their hospital bag. Okay, if you're in your 36 to 37 weeks of pregnancy, you should not wait until contraction starts before you get your hospital bag packed. By this time, your hospital bag should be packed because at any point, labor can just kick off. Now, while you're packing that bag, ensure these 5 things are being included. It's a must. Number 1 is maternity pad or your comfort pad. Now, this will be placed under your undies to receive those bloody discharge after delivery. It will also help to monitor if you're bleeding or not. Number 2 is your baby diaper. When the baby is out, there should be a diaper to wear that baby. Number 3 is baby shawl or a mini blanket. This will be used to wrap your baby, to keep that baby comfortable while you're staying in the hospital or when you're going home. All right? Number 4 is your baby clothes. So while getting your baby's clothes, get unisex, okay? So you won't get disappointed on that very day. Maybe scan is telling you a different sex of a child. On that day, you might see something different. So it is safer you get unisex, okay? Ensure you pack them in your hospital bag, okay? So the last one is your own maternity gowns, comfortable wears. Just get a very comfortable losing maternity gown or all these loose top, loose wear, just to make you comfortable after delivery. You can also add your wrapper. Okay, so these are 5 things you should ensure you have in your hospital bag, included and packed and ready to have your baby. Congratulations in advance. You're risking the life of your baby if you do any of these things I'm going to list now. Number 1, if you're that type of mother that lies your baby on your baby's tummy, you think you're doing good for that child. No, you're not. You're actually putting that baby at risk of what we call sudden infant death. Now, newborn baby, they are not very that active. They are not strong, that if you place them on that tummy lying position and by any means, any part of their nose gets occluded and they are not able to breathe well, they won't be able to move from that position. And if you don't meet them on time to change them, that baby can suffocate and die in that position. The right way to lie your child is on their back on a firm bed, firm mattress, okay? Number 2 is placing items on your baby's bed, Bible, bed sheet, blanket, wrapper, blah, blah, blah. You put it on the baby's bed. Now, despite the fact that you're lying that baby on that baby's back, if the baby moves hand like this and drag any of those material, places on the baby's face, that baby places either blanket, bed sheet, or any clothes or anything you have placed on that bed, on that baby's face. Even if that baby is suffocating, struggling to breathe, that baby will not be able to remove that cloth or remove that thing. That baby can suffocate and die there if you don't meet that baby on time. Okay. Number 3 is giving baby that is less than a year honey. If you give your child that is not up to a year honey, you are putting that child at risk of what we call botulism. Now, honey can contain bacteria that causes this botulism. This botulism is actually rare, but it's a serious infection that can affect the baby's nervous system. It can even make that baby to be paralyzed. All right. Number 4 is giving your baby under 6 months water. Breast milk and formula gives a healthy baby all the water, all the fluid they need in the first 6 months of life. When you give your child that is under 6 months water, when the healthcare provider has not instructed you to do that, what you're trying to do for that child, it will reduce that child's breast milk and formula intake. And in some cases, that child can suffer what we call electrolyte imbalance. Number 5 is putting substances, things on your baby's umbilical cord. Some of you would put toothpaste, hash, or the herbal concoction on your baby's umbilical cord. That thing can introduce germ into that baby's body and cause a serious infection for your child. Keep the umbilical cord dry and clean and follow the instruction. What your healthcare provider has asked you to use for that umbilical cord, that is what you should use. Number 6 is not taking that child for an immunization. That child is due for a particular immunization. Instead of you to take that child, you kept that child at home. It's not like the child is sick. You just decided not to take the child for an immunization. That is very wrong. You're actually harming that child's life on the long run. Number 6 is shaking your newborn or shaking your baby. When you shake your baby, it puts that baby at risk of brain injury. Some can even go blind from there. Some can have disability that won't be fixed for life. Some can even die from that process. So do not do that. Number 7 is allowing sick people to carry your child. You're seeing that your visitor is coughing, is having cold, catarrh everywhere. You still carry your newborn baby and give to the person. The person will carry your newborn baby. Some may even be kissing your newborn baby. You're putting that baby at risk of illness. That baby's immune system is still very immature, and that baby can easily contract that illness that person is having. And never allow anybody, either sick or not sick, carry your baby without them washing their hands. All right? Next one is delaying to take your sick child to the hospital, despite the fact you have seen that the child's condition has changed. If you do that, you are actually putting that baby's life at risk. Okay? Because when you delay the medical care, before you take that child to the hospital, they might tell you that it is already too late. When you have seen that your child's condition has changed or your child is sick, quickly take that child to the hospital immediately. Early intervention matters a lot. So if you do any of these things I have listed now, you are definitely putting your baby's life at risk. So it is time you change from these unhealthy behaviors.